Hi, Julie. Thank you so much for being here today.
Hi, thank you for having me.
Absolutely. Um, so you work as a nurse practitioner at the Sarah Cannon Cancer Institute at Research Medical Center, correct?
And at Overland Park Regional. I just
Okay.
recently transferred to Overland Park, but I'm helping out at research right now for a
Oh, fun.
colleague.
Okay, so you just are all over. So can you just tell us a little bit about your work and what kind of patients you see on a daily basis?
Well, fortunately, I have had a wide variety of experiences over the last 30 years. I have been in oncology since 1992, since the day I started.
Oh, wow.
But yeah, a long time, isn't it? I'm dating myself.
No.
Currently, I am in GYN oncology, so women's cancers, basically uterus, endometrial, well, that's the same thing, and
Yeah,
ovarian. Um, so that is what my passion is. And I'm just so grateful to be able to work with women one on one right now. It has just been a dream come true.
that's very cool. I'm sure it's a challenging job at times too, though.
Oh, it is extremely challenging. Women go through so much.
Yeah.
And what we have our bodies go through naturally just from Mother Nature, let alone when we get diagnosed with cancer of any kind. It is just amazing how resilient we are. And people will think and say, crying or showing this emotion or something, something that is a female, what they consider a female trait is weak, but it's not weak. It is just the opposite. It is strength, and it's a strength us women pull from our toes when we need to. So I am the luckiest person working with the group I work with, both as the patient, the family members, as the people I work with.
That's very cool. I was just telling my daughter, we were explaining periods and also migraines because we're a migraine family. So she's starting the kind of, and then she said, and girls have to have the babies too. That doesn't seem fair. And I was like, oh, just you wait.
Oh, God bless her.
I know it's not fair, but I agree. We have a lot of strength. So something that has been in the news a lot, kind of switching gears, has been the link to alcohol and cancer. And I feel like there's been kind of some big, scary headlines. We knew there were risks to alcohol, but some kind of scary headlines about just one drink can be, increase your risk. So, can you kind of walk us through that and, from your perspective, what the link is between alcohol and cancer?
Well, there are some established risks associated with several malignancies. And fortunately, this is a potentially modifiable risk factor for cancer, according to the American Society of Clinical Oncology. Alcohol has been associated with increased risk in several cancers, especially in those who are classified as heavy drinkers.
Okay.
Now, heavy drinkers, it's considered more than 7 drinks in a work week or in a week. Okay. Now, with that being said, there are certain cancers that show more of an increase in the risk for the developing a cancer: head and neck, breast, what we call gastrointestinal cancers, which is your esophagus, your colon, your rectum, pancreas, as well then as your lungs. All of those are at risk for developing a malignancy from alcohol consumption. There's also alcohol can be associated and has been associated with liver disease, pancreatitis, kidney dysfunction, blood disorders, gout, osteoporosis. So it's not just with
Good.
one thing. It is,
Right.
wow. So it is scary. It is
Yeah.
very scary.
Yeah. Um, yeah, that's a long list. So when talking about that risk, how does that affect women differently than men?
Well, you could take a man, same height and weight as a woman, and because of the distribution in water in our bodies in comparison to men, we are at more risk to experience hangovers, alcohol-induced blackouts, and then, of course, the increased risk, even with a low consumption of alcohol, puts us at risk for breast cancer.
Okay.
So, like your daughter said, and we have to deliver the babies too,
Yeah,
but
right?
it's the same thing. Why, we have more risk, our bodies just physiologically, we tolerate alcohol different. And where one drink for us women is one drink a day for us women is considered low consumption. A man can have two. So right out of the gate, we have that difference.
Okay. And so, in thinking about that, is there a safe amount of alcohol?
That's an excellent question. And it depends on who you talk to. So, with that being said, the American Cancer Society advises complete avoidance of alcohol for cancer prevention. Health and Human Services recommends is low alcohol consumption, which by definition is one drink or less a day or less than seven drinks in a 7 day period or 1 week.
Okay. So, definitely none or one is the.
Exactly.
Okay. Uh,
And I would be a hypocrite if I said I did not consume alcohol,
right.
but it's like, my goodness, that does put us at risk.
Yeah. So, when I read it, like I have an occasional glass of wine, but started to feel kind of guilty. I feel like it's when the information came out about like hot dogs and deli meat, and it was like the worst. You should definitely avoid at all costs. Um, so, what would you say to women who look at this advice that kind of varies a little bit about reducing their risk and they aren't sure where to start or where the line is? What are you telling people?
Well, safe amount of alcohol is dependent on your individual history. The safe amount of alcohol for a pregnant woman is not.
Right.
That's what our current research has shown us. But it is also known for individuals who have a high family uh, rate of alcoholism. If you have pancreatitis, you should avoid alcohol altogether. If you have liver disease, you should avoid alcohol altogether. So I recommend for people, it's a one-on-one conversation you need to have with your patient, and being comfortable with your provider to have that conversation and being completely honest is paramount.
Okay.
So that way you are getting the best information and not just following Dr. Google or an influencer.
Right. And I would assume if your cancer risk because of history or family is high, that you would also it would be.
Exactly.
Yeah. Okay.
Exactly. Because even low consumption of alcohol increases our risk for breast cancer. So if you already have let's say, a gene mutation, which is not a modifiable risk, that because we can't change who our parents are, who our grandparents are, but we can uh, take care of those modifiable risk factors like alcohol, tobacco, those sort of things.
And is there anything difference between wine or beer or hard alcohol, or is it all the same category when it comes to risk?
That's an excellent question. There is not a lot of great data out there
Okay.
that pulls that information out.
Okay.
Now, there are studies with wine and heart disease,
Mhm.
But with women, even there was another study that showed that women with beer consumption increases our risk right away, even with low consumption. So it also depends on what study you're looking at,
Yeah.
but they haven't pulled that much out from hard alcohol, wine versus beer.
It just sounds like it's not great no matter what.
That is just so true, so true.
Yeah.
And we have to listen to our bodies. That is so important that we don't ignore what our bodies are telling us.
Yeah. So what preventative screenings do you recommend for women when it comes to their cancer risk?
Oh, well, let's start with prevention, not just screening, but let's look at low-lying fruit, easy things. The modifiable risk factors like no smoking, avoidance of sun exposure, using SPF, a good rainbow diet, minimizing processed foods. Those are all things that we can do that are easy for us to adjust.
Right.
So then with that said, there are screenings from the American Cancer Society that tells us based off of our age group, what is the recommended screenings. Oh, and there's also, I would be very remiss if I did not suggest HPV vaccines.
Mhm.
That's very important to help minimize our risk for cervical cancer. So just out there, very important. But between the ages of 25 and 30, cervical cancer for all people with a cervix, starting at 25, that's extremely important. Between ages 40 and 49, breast cancer screening with mammography starts at age 45 and earlier, depending on your family risk and what genes were passed down to you. Cervical cancer continues through this time frame. And then colorectal is added around age 45, also earlier, depending on your family history. Then after the age of 49, we have my age group over 50.
Mhm.
We continue with the routine breast, cervical, colorectal. For the gentleman, we add the prostate, and then we add lung cancer screening
Yeah.
if you have a history of tobacco consumption, whether in the past versus and current. How much in the past, when you quit, all comes into play if you qualify for lung cancer screening.
Okay.
After the age of 75, we need to look at that on an individual basis with your each provider and patient because after 75, depending on your history, your gene makeup, how many a risk you have will depend on if they continue which screening test.
Okay.
Does that
All
make
right.
sense?
It does. It's a lot to think about, but very important.
It is. And having people talk about it with their provider, having a good provider that is knowledge based in this area is so important. Fortunately, at um, our cancer centers, we are well versed, we are multidisciplinary, we utilize the physicians, the advanced practice providers like me, oncology certified nurses and pharmacists that want to take care of our patients with our best care because it's our honor to take care of people. We are so lucky to be in this role. And I can't stress enough how when someone says that they trust me, that is the greatest honor I could ever receive.
That's fantastic. Well, your patients are very lucky, and I hope no one listening has to come see you. But if they do, it's so great to have people that are passionate about what they do and care about. Thank-
Well, I'm so fortunate with Midwest Oncology Associates, how wonderful our team is to be a part of and work with. Uh, I just have the greatest position ever. I'm just lucky.
That's great.
I get to meet people like you.
I get my mammograms at your, I've had two, but I've had them at your facility and always had a great, easy experience. And I can't stress enough how like nervous I was for that first one and how easy and painless. I know everybody's isn't, but mine is completely painless. And I'm there like 10 minutes.
That's fabulous. They have made such strides across the nation
Yeah.
on improving that experience for women. And I know as an institution that I work with, we want to know what us women have experienced going through our facility because we're here for you. That is first and foremost. And that old adage, an ounce of prevention is worth a pound of cure, is so true. So very true.
Well, we'll use our closing to encourage people to whatever age group they're in, get those screenings and then focus on those modifiable and cut back on that glass of wine.
There you go.
All
Oh,
right.
I'm
Well,
so grateful.
yeah,
Thank
thank you so
you.
much, Julie.
You have a wonderful day.
You too.
Okay. And if there's anything anybody ever needs, just point them our way. More than happy. Even if I don't know the answer, I will guide them in the right direction.
That's fantastic. Thank you.
Thank you. You have a